With Democrats winning a pair of runoff elections in Georgia, the party will control the Senate for the first time since 2015, and President elect Joe Biden's party will narrowly control both chambers of Congress. That power will help Biden to enact his agenda, but the slim margins that make up their majority means that Democrats will need to carefully navigate the factions of their party and may need to find areas where they can work with Republicans. Democrats have made expanding health insurance coverage and lowering prescription drug prices key priorities in their campaigns over the last several years.
Because health care is a human right, Atlanta.
And their base will expect them to deliver. Controlling the Senate floor does mean that Democrats should have an easier time confirming President-elect Biden's nominees for the cabinet and other key federal roles. Many Republican senators have raised concerns about Biden's picks for HHS Secretary designee California Attorney General Xavier Becerra, but Democrats likely face fewer hurdles given that they can set committee hearings and votes and will control the Senate floor schedule. When it comes to advancing legislation, however, Democrats' path will be narrow. They'll need to have unity in their party and may need to pick off Republicans' votes if they don't. Continuing to respond to the coronavirus pandemic will be what's driving the legislative plans. New York Senator Chuck Schumer, who is set to be the Senate Majority Leader, offered just one specific policy goal on Wednesday, providing $2,000 in stimulus money to most Americans.
One of the first things that I want to do when our new senators are seated is deliver the $2,000 checks.
But if Democrats want to advance more partisan priorities, they'll likely turn to the wonky process known as budget reconciliation, a tool that allows lawmakers to pass legislation with simple majority. But that process has its limitations, as all provisions must be deemed in compliance with the so-called Byrd Rule by the Senate parliamentarian. It's most likely that lawmakers' health agenda is going to focus on outside-the-box policy priorities, such as building on the 2010 healthcare law known as the Affordable Care Act. House Democrats last year passed legislation that would build on that law by increasing subsidies that help people afford their monthly health insurance premiums. That's likely to be a starting point for legislation in both chambers this upcoming year. That could also include efforts to lower prescription drug prices. Some of the more ambitious policy proposals that Democrats have been debating in the last several years, like a public option or a Medicare for all single-payer system, are considered less likely to happen at this point, partly because of the Democrats' slim majorities in both chambers, not being able to get 60 votes in the Senate. Republicans are unlikely to support either of those proposals, including the more moderate public option. Regardless, healthcare policy, ranging from the coronavirus pandemic to health insurance coverage and drug prices, is set to continue to be a key issue on Capitol Hill in the coming months.